The largest study ever done on medical errors in hospitals during and after surgery. It is being released this morning, and it includes a big red flag for patients going into surgery. It pinpoints exactly when they are most likely to be given the wrong medication or the wrong dosage. ABC's David Muir is here with that. This is huge.
Huge. We've heard so much about medical mistakes. This study looks at the medicine that we're given, and it makes it clear that when surgery patients go into surgery, they should be most vigilant about that medication that they're given. It finds that adult patients are most likely to experience a mistake with their medication in the operating room. And for children, mistakes are most likely to happen in post-op or after surgery. This morning, the medical mistake that happened to one woman's newborn and what experts say you can do to avoid it.
Just 1 week old, tiny Dawn Jeffries was struggling to survive. She was one of 6 premature babies accidentally given an adult dose of the blood thinner heparin at an Indianapolis hospital.
My baby was fine before they gave her the heparin.
The problem? A mix-up of nearly identical vials of medicine. Fortunately, baby Dawn survived. But the kind of mistake that sickened her is not uncommon. 1.5 million patients suffer from mistakes with the medicine that they're given every year.
They are likely to cause harm is probably at a higher rate than any other error.
In a new report out today, the public agency that examines the way we're given medicine looked at 11,000 errors in just the last 7 years, all of the mistakes involving the wrong amount or the wrong medicine altogether.
5% of the medication errors in the surgical continuum were harmful errors. And this was more than 3 times higher than the rate occurring in the rest of the hospital overall.
For adults, mistakes with medicine occur most often in the operating room, the wrong drug, or antibiotics not given in time to prevent infection. For children, mistakes most often happen in the recovery room, where 20% of the errors had harmful effects. Nearly as many mistakes with children's medicine occur in the operating room.
Children are at particular risk for medication errors because the doses that are required for children are often doses that need to be calculated.
Why so many mistakes with medicine? Authors of the report believe at least one of the solutions is obvious.
There are no single individuals assigned to track you and your medication.
And while it might be an obvious solution, medical experts will tell you it's unrealistic to have one person assigned to you as a patient and to stay with you to monitor your medications. They say a better solution would be an electronic medical record that nurses could constantly access, have it right there in the operating room and in post-op so they can see what you need and what your medical history is.
Electronic, but that's going to be some time before they're able to do that. What do you do in the meantime if you're a patient?
They say be vigilant, be aggressive with your doctor, ask as many questions as possible. A lot of people are a little afraid to ask the questions, but you have to ask about the medication you're going to receive, and if it's your child, particularly the dosage, because it's so important how they divvy out the medication. They also say be sure to bring an up-to-date list of all the medication you take to the hospital, how often you take that medication, and of course any allergies that you have. And be sure that when you're going into surgery, ask, do you have my medical chart? Is the chart right there next to my bed?
Don't be afraid to ask.
Never.
David, thank you.
You bet.